Welcome to part 2 of my birth series, in which I will be covering the biggest lies told by the obstetric system regarding birth and how this affects women and why it matters. Before we begin, I want to clarify that this information is not prescriptive. You are allowed to make whatever choices you want for your birth process and pregnancy. My problem is that when women are told lies from childhood about the birth process and the dangers and the risks of having a baby, then their decision making isn't authentic and it's based on non-truths, and that's not informed decision making or consent or anything. That's just fear-based decision making. If a woman knows all of the valid, correct information about how their bodies work and how birth works and what is actually true about this process, then they can make their decision. And I support, it doesn't even matter what I think of your birth anyways, but I support a woman deciding to birth in a hospital or getting an elective C-section if that's what she wants to do. But what I don't support is a woman being told that her body is inherently broken from the very moment she conceives by every medical practitioner she meets, and then making decisions from fear and not wanting to allow their baby to die because a doctor wasn't present or they didn't do the right test. That's absolutely nonsensical. And it's actually been devastating for genital birth outcomes for the last 3 generations. People say that birth outcomes today are better than they ever were. And that's going to be the first lie I cover. But just on its face, it's just completely false. There's more postpartum depression. There's more emergencies. There's more C-sections. There's more inductions. There's more infections. There's more breastfeeding problem. There's more mastitis. Literally every measure of a positive birth experience is terrible. So I don't even know why this lie is so widely spread. Because moms aren't dying in childbirth, therefore the birth outcome is good. Oh, guess what? We have absolutely no substantiated proof that women were dying all over the place from childbirth. So let me go into the first lie, which is that. This is similar to the lie that most people believe, that people didn't live as long back in the day. This is a lie that's completely statistically skewed because it includes childhood deaths. There were a lot of childhood deaths from infectious and bacterial diseases, and this was mostly due to contamination and the lack of plumbing. Antibiotics obviously help, but once you made it past childhood, you were just as likely to live as long as we're living today, and probably with less chronic illness. So that was just a quick comparison to another very widespread lie that we're told about the past. Okay, back to obstetrics and childbirth. I want you guys to really listen carefully to this because apparently nobody knows this. But the only statistics we have about deaths in childbirth come post the involvement of doctors and the medical system in childbirth. So we don't have any statistics of women giving birth undisturbed, meaning without medical practitioners present. The only data collected for these statistical claims was already after doctors got involved. So how can we say that women had poor birth outcomes before birth was medicalized? The outcomes were always measured in a medicalized environment. The only thing you can claim is we have better birth outcomes in today's medical system versus the medical system of the past. Yeah, of course. They're washing their hands after doing surgery and touching cadavers now, so that helped. And they've learned on generations of mistakes of obstetrics, like x-raying babies in the womb and hoisting women upside down to give birth and giving them drugs that were detrimental to their unborn children and themselves. Yeah, they fixed a lot of the mistakes that they were making. So of course today it's better than it was, but we cannot make the claim that it was better than before doctors got involved in birth. Let me give you an analogy. Let's say a woman lives with a man who is potentially abusive. The woman falls down the stairs because he pushed her. She gets hurt and he calls the ambulance after putting pressure on her wound and helping save her life. And we go, thank God there was this guy present in her house when she fell down the stairs. Otherwise, she would have died. Well, none of that is a lie. Yeah, he helped save her after he pushed her down the stairs. This is kind of how the logic of today's obstetric system works. A woman, by default, is in an environment to give birth that is inherently abusive and inherently does unnecessary things to her, which very often create a cascade of problems and complications. And then they save her. Wow, thank you. All right, so that's the first misconception cleared up, hopefully. The second lie that I want to discuss is also based on faulty data. And the lie is that all breech birth is inherently very dangerous. This is based on one study that claimed that breech birth was dangerous, that has since then been completely debunked and thrown out. And yet, the practice and the misconception remains, because once doctors begin practicing something or stop practicing something, it's really hard to undo that, and they just keep going with it even if there's contrary information. The study claimed that breech births had much poorer outcomes than head down births. Breech, by the way, means your baby is feet first or butt first instead of head down. So the study claimed this, but it conflated the negative outcomes of premature births with breech births. Most premature births are going to be not ideally positioned because they haven't come down and prepared themselves for their birth. They're not to term. Something has gone wrong, either genetically or for whatever other reason, and there's going to be a lot more breech presenting premature births than term births. But you can't say that the poor outcome of a premature baby with that's having issues and that's why they're premature is the same as a breech baby, and that position being bad and responsible for the poor outcomes. Anyways, 10 years after this study was widely popularized and accepted, a doctor debunked it. It was thrown out of the medical community, but like I said, they just haven't gotten over it. And there's very few doctors that are trained in breech delivery, and most people think it's like the biggest risk ever. So no one's even given the chance to attempt breech birth in the hospital. There are dangerous aspects to breech birth if they were to happen, such as cord prolapse and footling breech, where the feet are coming out first instead of the butt. These are nuances, and they should be assessed as they happen and dealt with, and that's fine. I think cutting out every single breech baby or perceived to be breech babies churn up until the moment of birth, really. They can churn last minute, and often they churn to a breech position after being checked like 2 hours before they come out. So it's just, they're happy with the risk of C-section, but they're unhappy with the risk of a natural, unideal positioned birth. So that's their choice, but it's based on a lie. So, okay. The third lie is also incredibly popular and quite retarded, and also based on bad statistical data from the past. And it is baby too big, hips too small. Let me tell you where this comes from. Women used to get rickets, which is a vitamin D deficiency, especially in, northern parts of Europe and England where there's not that much sun. And after industrialization, women had indoor jobs. So rickets was pretty widespread. And what rickets does is it malforms women's bone structure, including their pelvic bones and hip bones. So yeah, during that time, there were babies getting stuck and women were dying from this and babies were dying. And that's it. That's where the lie comes from. And we're still going with it, going strong. If you are a healthy woman who never had rickets, your baby's not too big and it's not going to get stuck in you. There is zero evidence for this. It just isn't. There's no statistical data on this. It's all assumed, perceived, and perpetuated based on nothing. I could go on and on about this, but if you want to believe that your body is, or your wife's body is inherently broken and flawed and either evolved or created wrong, that's your prerogative. But to those who are open to the fact that their body is created for basic, normal, natural processes, and for women that is giving birth, you will be fine. Your body will not make a baby that's too big to come out. Your hips widen when you're pregnant. Your cervical bones are malleable and they shift, especially in more optimal positioning than lying down to give birth. Squatting, leaning forward, all fours, all open up your cervical opening to a much greater extent than lying down. And also, the baby's skull is malleable and it shifts and moves with birth. Now, again, these problems, even though induced by hospital intervention, can be real. So if your baby is stuck and there's apparent shoulder dystocia, or the baby's not progressing out of you in the hospital, it's yeah, there is a problem. But I just want to emphasize that the problem is created by the hospital environment, interventions, and setting. Like the guy pushing you down the stairs analogy. He created the problem. The problem is real. You fell down the stairs and it needs to be fixed now, even if it's by the perpetrator. Baby too big? Not really a thing. And if your ultrasound is telling you that your baby is too big, keep in mind ultrasounds are incredibly unreliable and have absolutely no statistical data behind them for improved birth outcomes. Did you know that? So I'm going to segue into ultrasound, which is the next lie. Did you know there's no safety trials on pregnant women with regard to ultrasound? There's animal trials that show early birth, low birth weight, and fetal tissue damage. But there's no Western trials on pregnant women. So we've been using a technology for generations now that we haven't tested the safety of, except in China. So there is, because China doesn't find testing on pregnant women to be immoral like the West. And they did do a study on mothers who wanted to abort their babies anyways. The study ultrasounded mothers at different gestational times for different lengths of time. They used the standard ultrasound settings. Then when the baby was aborted, it was autopsied and fetal tissue damage was found in all of the tested babies. And the ones that were tested the longest, so the ones that had the most ultrasound exposure, had the most fetal tissue damage. So every time you ultrasound your child, there is fetal tissue damage happening. We are not told this. Also, the measurements they take in ultrasound are highly unreliable and flawed, and often end up being totally false and are often responsible for inductions and C-sections and recommendations that actually hurt the mother and the baby because they were just simply inaccurate. Like, oh, your baby's so big, we have to cut them out now. And then they C-section you and your baby's like 5 pounds and premature. This happens more than you think. Also, the measurements they take for Down syndrome using ultrasound are also highly unreliable and have resulted in who knows how many unnecessary abortions of babies that were perfectly healthy. Not that I think that it's ever necessary. Let me just put it this way. If you're anti-abortion and you're not gonna kill your baby because of a potential defect, then why ultrasound? Lie number whatever, I've lost count. There's so many. Hemorrhage. The lie is that hemorrhage is incredibly prominent and that's why we need to jab you with Pitocin no matter what. This has been something that's happened to me, and they kind of just changed the definition of hemorrhage to fit their, fit all the situations. Hemorrhage is supposed to be like a life-threatening bleeding that won't stop by itself and will drain the mother till she dies. What usually happens is you start bleeding a normal amount or what is perceived to be abnormal by the medical practitioners, and they just preemptively call it a hemorrhage and jab you with fake hormones that block your real hormones and the process of post-delivery DMT release, etc. And then your postpartum is sabotaged because they didn't like how much you were bleeding. And then they call it hemorrhage, so they saved your life. You're welcome. Usually, we just don't even know if it was a real hemorrhage or anything because they just do it as protocol. You could say, better safe than sorry. It's kind of like the dick cutting logic, right? Better cut off all the dick skin from all the babies just so they don't have to wash it as much, and so you can prevent a couple infections, allegedly. It's just terrible medical logic. You can't preemptively do things just in case some crazy situation occurs. It's not valid. That's not how you're supposed to be practicing medicine. And then they just deny all the negative aspects of getting the Pitocin jab. The next lie is water's breaking early and that being incredibly dangerous and likely to cause infection. What causes infection is medical practitioners sticking their hand in your vagina, birth canal, cervix. That's what causes infection. Water's breaking does not do that. And also, if your waters break early, they often heal and refill again. Did you know that? It's pretty cool. The body knows what it's doing. The next one is baby positioning, and I kind of touched on this with breech birth. There's many positions a baby can take, and again, there's no data that one leads to horrendous birth outcomes and another one doesn't, or to pain or less pain. Babies move around. They move around up until the moment of birth, and it's just not a problem. And to fearmonger and brainwash women into thinking, oh, your baby's positioned this way, so you're going to have a really tough back labor, or you're going to have a tough time giving birth vaginally. And this is also based on, an ultrasound weeks before she's even going into labor. So the baby's changing every hour. They move around a lot. It's just all, it's to tell women that their bodies are broken, just like we tell men that their penis is wrongly made and we need to cut it, and whatever other lies we're told by medical professionals every day. It's dehumanizing, inhumane, and just not scientifically valid either way. So yeah, baby positioning is just basically pseudoscience. The last lie I'm going to go over is not progressing. Labors can be really, really, really long and hard. And dilating can take a really long time. And if people are sticking their fingers in you and bothering you every 20 minutes, yeah, you are naturally going to stall your labor. Like, it's a fear survival response. Your body is telling you that there's someone fucking raping you because they're sticking their hands in you, okay? And your body's like, run away, close your cervix back up. It's actually that simple. There's even really old records of when doctors started observing birth. And there's one where he describes walking in on a woman who immediately sucked their crowning baby back up into their womb and stopped labor. It's almost like doctors have been conditioning us from our very first gynecological visit, where they stick things in us, that it's okay for random strangers in the lab coat to stick their body parts and instruments into a girl's vagina. This just was never allowed in normal, modest, conservative society. And now it's just like, yeah. I'll do a whole video on that because I think it leads to a lot of negative sexual outcomes and conditioning for pornification. But anyways, your body goes into a survival response, and that's why your labor stalls. Go walk in on a cat giving birth. They're gonna stall their labor. This is why animals go and do it in private. And I mean, some people really don't like animal comparisons, fine, but this does happen to humans. It's like, oh, it's so stupid. It makes me so mad. So yeah, long labors happen even at home, in private. So imagine how much that process is going to be disturbed with a bunch of random people walking in and like touching you and shining lights on you and hooking things up to you and your baby and all that stuff. And then, of course, you get tired and you can't do it anymore, and then you get cut. Or if you were induced, like, the pain from induction is just insane. Of course, it leads to a higher rate of C-sections. But yeah, the fact of the matter is, not progressing is not a thing. Your baby will come out. Women give birth in their sleep, in a coma. So you actually don't even need to be conscious to give birth. Unless there's something wrong and you're having an emergency and a medical issue, your baby will come out of you eventually. Saying that, I have empathy for women who have gone through long labors, and it can be really intense. So don't take this as a judgment if you chose to get a C-section or get an epidural. Like, that is your choice. That's fine. But to tell women who are going through the natural process of labor that might have not even been that long yet, that your labor stalled and you're not going to open up anymore, and thank goodness we're here to cut you open, that's a lie. That's not true. The informed and honest thing to say would be, you're having a very long labor and we don't think you've dilated very much. Would you like to keep trying in privacy, or would you like us to intervene? Like, that would be a reasonable thing to say to a woman, but that's not what's done. I want to end on some statistics that we do have, and that's from at-home midwives. And even though at-home midwives are usually regulated, licensed, and heavily medicalized and trained similarly to doctors, their outcomes are still much better than hospital outcomes. So what I've seen is they have a 1 to 3% transfer rate to the hospital. And most of those transfers are non-emergency transfers. So usually it's from exhaustion and the woman giving up. Again, that is a valid reason for a woman to want to go to the hospital. But it also depends on the circumstances of how she made that decision. If she has a midwife that's going, oh, honey, you're so tired and your labor is stalled and we should just take you in now, that's a shitty midwife, and she just wants to go home. So I don't know what the point of her is. But, you know, if you are sincerely so exhausted from your labor and your midwife is incredibly supportive, that's a different story. You see, there's a lot of framing to all of this. Okay, so their outcomes are already significantly better. Just based on these at-home birth statistics and the low transfer rates and then the even lower reasons for emergency transfer, we can deduce from that birth was not a incredibly inherently dangerous thing. Another thing people like to say here is, well, the developing world has terrible birth outcomes and the modern medicine world has great birth outcomes. The developing world still subjects their women to medicalized birth. You're comparing just a better medical system to a worse medical system. Of course, the better medical system will have better outcomes. That doesn't mean that a medical system inherently creates better outcomes for women versus staying at home and birthing without the system. You're comparing like a rotten apple to a fresh apple. Also, obviously, I mean, like, I hate that I even have to say this, but obviously there are true emergencies and things that cause the death of the mother and the baby that will present itself, and it will be very obvious. And then, you know, anytime a woman feels something is wrong, right? If you feel something is wrong and that fear is real and it isn't based on months of doctors fear-mongering you, okay? You have a real intuitive fear during your pregnancy, of course, go to the doctor. They're there for the emergencies. They shouldn't be there all throughout your pregnancy and birth, mismanaging you and sabotaging you and then acting like they saved you. What they should be doing is saving you in those real emergencies. That's it. Feels like common sense. Unfortunately, that's not what we're getting. So give birth however you like, but make those decisions based on facts and objective observations versus lies and propaganda and misconceptions. That's it.